إن شاء الله. فاللي هو السؤال حاليا اللي بيسأل نفسه أو بيطرح نفسه أو أغلب الأطباء بيسألون له، وحاليا هم هنا في الزوم برضه في كمية من الرسائل، اللي هو سؤال واحد: في هلع ما عادي في الكادر الطبي،
ايوه
ما طبيعي، يعني ما عارفين يحموا نفسهم كيف من المرض، وفي نفس الوقت ما عارفين 200 يخشوا في حته بتاعت سيلف ايزوليشن، وما عارفين 200 يرجعوا للشغل. فانا متاكد تماما وزاره الصحه خطت البروتوكولات لكل الناس، وفي كل مستشفى وفي كل ولايه في كوادر يعني من وزاره الصحه شغالين معاهم. لكن برضه تخيل التذكير في الايام دي التكرار ما في زول بيمل منه اصلا. فيا ريت تورينا رؤيتك في الحته دي شنو، ودكتور احمد ان شاء الله بعد ذاك حيبدا طوال الباوربوينت برزنتيشن بتاعه. تفضل دكتور ماهر.
طيب انت في باوربوينت برزنتيشن ولا اتكلم؟
انت ان شاء الله حتبدا في التعليق، ودكتور احمد عدلان ويبدا لنا ان شاء الله بالباوربوينت، عنده 2 سلايد عن البي بي ايز، وبعد ذاك انت حتواصل ان شاء الله في الحته بتاعت الباوربوينت بعديه طوال ان شاء الله. تفضل دكتور احمد عدلان، حط الباوربوينت.
السلام عليكم ورحمة الله وبركاته. شكرا جزيلا عبد العظيم على الإضافة، وشكرا للأخوة القرب في هذا المجموع. أنا داير أتكلم الليلة عن موضوع مهمة جدا، وهي موضوع Personal Protection Protective Equipment PPE Aerosol Generating Procedures. طبعا الوباء الكورونا حصل مشكلة في العالم كله عشان سبب الفيروس السارس كوفي 2 فيروس يقدر ينتشر and is a very efficient virus and very virulent. The transmission غالبا due to inhalation of air droplets. والناس الشغالين في الصحة في المستشفيات مش بس الدكاترة والممرضين، حتى الناس السواقين في الإسعاف مثلا، they're at high risk of having an infection, acquiring an infection or transmitting an infection. عشان كذا لازم نعرف كيف هل ممكن إحنا نحتفظ to protect ourselves من هذا الانفكشن and الانتشار. ممكن تلبس حاجة اسمها Personal Protective Equipment PPE.
Dr. Ahmed, feel free if you want to use your own language. So Dr. Maher, later on he can explain more in more detail.
Don't worry, I speak in English, Ahmed.
Okay. So we have 2 types of personal protective equipment: standard on the left and aerosol generating procedures on the right. And it's very important that we use this equipment whenever we deal with patients who have COVID confirmed or suspected COVID. So I'll begin with the standard PPE. It's very simple. You have an apron, which is disposable, gloves, which are also disposable, and a surgical mask, that like the ones you will find within a hospital, usually in the operating theatres. This is the standard PPE. The second type is for aerosol generating procedures. And this is defined by the World Health Organization as a medical procedure that results in the production of airborne particles or aerosols, which may be pathogenic. Here are some examples of aerosol generating procedures. At the top is the cardiac arrest situation, where you have cardiopulmonary resuscitation or chest compressions. Cases where you are intubating or extubating patients, they are aerosol generating. Bronchoscopy, ENT procedures, very high risk of aerosol generation. Also non-invasive ventilation, so this is CPAP or BiPAP. Sputum induction and chest physiotherapy also have a high risk of aerosol generating, and using airway suction. So you can see here that the PPE that we use for aerosol generating procedure is more advanced, but it contains 4 elements. Number one, a fluid resistant gown. This is very important that it's fluid resistant so that the droplets can't go through and infect you. Secondly, gloves, which are disposable. There is also a special mask to wear, an FFP respirator mask. This mask prevents the inhalation of the particles, and fourthly is a shield, either over the face or over the eye, to protect you. Here are 3 examples of FFP. On the left is a disposable half mask that you only wear once and you have to dispose of it. In the middle is a reusable half mask, which you can use more than once, but you have to wash it after every time you use it. And on the right-hand side is a full face mask. One of the most important aspects of these masks is that you must ensure that the mask you use fits to your face. And you have to perform face fit testing. And this is performed by professionals who know how to do this, and they will test to see whether the mask that you have actually works for you. Secondly, it's very important to practice how you put on the PPE, we call that donning, and how to take it off. I think Dr. Mahir is going to talk a bit more about that afterwards. There are videos available online on YouTube showing how you can put it on and take it off. And it's in my practice is very difficult. I find it quite difficult to do. And I think I recommend everyone to practice. So in summary, personal protective equipment is absolutely essential when you're dealing with patients with COVID or suspected COVID. You have to be very aware of what is an aerosol generating procedure to make sure that you wear the appropriate PPE for that procedure. You must ensure that you have your face fit tested to make sure that the respirator mask works for you, and do practice the donning and doffing procedure of PPE. شكرا جزيلا.
شكرا دكتور احمد. دكتور ماهر، عندك تعليق قبل ما احط لك السلايد بتاعتك على دكتور؟
والله is well presented، ممتاز، well done. يعني المشكله طبعا في السودان الفيت تيستينج will be difficult، لانه ما افتكر يكون في فيت تيستينج، لكن what he said is really يعني cover everything ما شاء الله. well done.
Okay.